Respected Principal, Vice Principal, teachers, ladies and gentlemen, a very warm good morning. Today, that is 7th April 2023, the World Health Organization will observe its 75th anniversary. In 1948, countries of the world came together and founded WHO to promote health, keep the world safe, and serve the vulnerable so everyone, everywhere can attain the highest level of health and well-being. On this World Health Day 2023, let us recognize the importance of prioritizing health and well-being for all individuals across the globe. The past 3 years have been challenging for everyone, and the ongoing COVID-19 pandemic has highlighted the crucial role that healthcare plays in our lives. The COVID-19 pandemic has exposed these inequalities and highlighted the need for a collaborative and inclusive to health. We must work together to ensure that all individuals, regardless of their background, have access to the necessary resources for good health. This year's theme for World Health Day is Health for All, and it resonates with the ongoing global efforts to address health inequalities and disparities. We must recognize that access to healthcare and health resources is not equal for all individuals and communities. Therefore, building a fairer, healthier world is imperative. To build a fairer and healthier world, we must address social determinants of health such as poverty, lack of education, and poor working conditions. These factors can lead to poor health outcomes and exacerbate existing health disparities. Addressing the social determinants of health can have a significant impact on reducing health inequalities and improving health outcomes for all. Furthermore, we must also prioritize preventative health care, focusing on promoting healthy lifestyles and preventing chronic diseases such as diabetes, heart disease, and cancer. We must also invest in education and awareness campaigns that encourage healthy behaviors and provide access to preventative healthcare services. On this World Health Day, let us unite in our efforts to build a world where every individual, regardless of their background or circumstances, has the opportunity to lead a healthy and fulfilling life. Let us work towards a future where health is not a privilege but a basic human right. And let us remember that the health and well-being of our communities, our nations, and our world are in our hands. WHO's 75th anniversary is an opportunity to look back at public health success that have improved quality of life during the last 7 decades. It is also an opportunity to motivate action to tackle the health challenges of today and tomorrow. So lastly, I would urge you to spare a couple of minutes this evening to watch the high-level dialogue entitled Health for All, Strengthening Primary Health Care to Build Resilient System, held by WHO on April 5th. This is String to signing off. Thank you.
Respected Principal, Vice Principal, teachers, all my fellow batchmates, and all my juniors, a very warm welcome to you all. I am Kezang Jamtsho from 12 Science A, serving as your health captain, and I will be reading a message from Dr. Poonam Khetrapal Singh, who is the Regional Director of WHO Southeast Asia, titled Health for All, United by Purpose and Driven by Action. Health for All demands not just commitment, but action from every person, everywhere. Today, on World Health Day, WHO celebrates 75 years of improving public health and well-being in Southeast Asia region, and globally, fully committed to achieving health for all through universal health coverage, which is WHC, when all people can access the health services they need, when and where they need them, without financial hardships. For many decades now, and since even before the 1978 Declaration of Alma-Ata, High-level leaders and policymakers from across the region have recognized the critical role that access for all to quality, affordable, and comprehensive primary health care, PHC, can play in achieving UHC and therefore health for all. However, global enthusiasm for WHC and PHC approach has witnessed several peaks and troughs, resulting in public health services and programs that have often become siloed, fragmented, and divorced from wider multisectoral social and economic processes and determinants. Today, in the shadow of the COVID-19 crisis, around 40% of the region's population is unable to access essential health services. In 2017, around 299 million people in the region faced catastrophic health spending, and an estimated 117 million people in the region were pushed or further pushed below the purchasing power parity poverty line of $1.9 a day, a figure that has since been exacerbated. History's lesson is as clear as it is urgent. Sustained whole of government, whole of society action is needed to achieve UHC and health for all. Since 2014, one of 8 regional flagship priorities and a core pillar of the region's vision to build back better from the COVID-19 pandemic. We must all contribute. First, high-level leaders from across the region must maintain and strengthen political and financial commitment to achieve UHC, accelerating momentum ahead of the second UN General Assembly meeting on UHC in September this year. The COVID-19 crisis has shown that when health is at risk, everything is at risk. It has shown that investments in UHC and health system resilience underpin not just health, but social and economic security, as well as the achievement of an array of sustainable development goals. Second, policymakers and program managers must continue to implement the region's strategy for PHC, launched in December 2021. Of specific focus should be strengthening public health infrastructure, workforce, and financing, while at the same time increasing equity for those at risk of or who are already being left behind. Shared learning must continue to be core priority, leveraging the full power of the region's new forum for PHC-oriented health systems. Third, people and communities must increasingly assert their voice and right to health, including by directly engaging in local health decision-making processes. As highlighted by the 2021 WHO Handbook on Social Participation for WHC, as well as the region's recently adopted resolution on enhancing social participation in support of PHC and UHC, individuals and communities can play a key role in monitoring health service performance and holding health providers and policymakers to account. Fourth, partners, donors, and other stakeholders in the region must go all in on UHC and health for all, recognizing that the PHC approach is the most effective, efficient, and equitable way to build national health systems that are unified and which achieve healthier populations, health security, and UHC. In all countries, policymakers must lead and partners must support. Assistance must be fully aligned with national priorities, avoiding duplication and fragmentation. Crucially, given the magnitude of the challenge, we must recognize that progress may not always grab headlines, but will nevertheless make a real difference to people's lives. Between 2010 and 2019, the region increased its USC service coverage index from 47 to 61. Between 2000 and 2017, the region reduced the number of households impoverished or further impoverished from out-of-pocket spending of health from 30% to 6%. Since 2014, the density of doctors, nurses, and midwives in the region has improved by over 30%, a tremendous achievement that must continue to be built upon. On this, WHO's 75th founding anniversary, let us unite in purpose and be driven by action to achieve UHC and health for all, ensuring all people have good health for a fulfilling life in a peaceful, prosperous, and sustainable world. With this, I wish you all a very happy World Health Day. Thank you and have a great day ahead.
What is important is, at least you should remember a few things from such global international days, so that you are reminded about your own life, you are reminded about your own health. I think very important today. When the teachers came to me and they told me about this short celebration in the morning, I was more reminded about my own health. If my health is poor, I cannot blame anyone, because it was me if I didn't do my own duty, how can I have a healthy and a better life? Okay? So you all know that. And then I told the teachers, we'll have to celebrate, we'll have to at least tell few things to the children. Okay? And then we were trying to get few people from outside. Looks like everyone is busy. We could not have them here with us. But nevertheless, I thought maybe I'll go down to your level, okay? Because you are young, 15 years, 17, 18 years people. Often you forget, see? Often you forget that your health is important. Because nobody told you. Maybe you didn't hear your parents tell you, you didn't hear the teachers tell you, maybe once in a while, like today's important occasion. Otherwise, you have not heard. I was telling one of the classes yesterday, you can have everything under the sky. Okay, you can become the richest man, you can have the most prettiest wives, husband, you can have the best of the best life. But if you die early because of your poor health, there's no meaning, am I right? That is why you can see that person like Michael Jackson died at a very young age. If you look at why he died at that young age, okay, one was drugs, chemicals, a lot of things went into. Okay? So likewise, if you don't take care of our health, there's no meaning to this life. I'm telling you, children, there's no meaning. That's why today, I think World Health Day, the celebration of World Health Day is very, very important. Not just for me, but for all of us. And then young people like you all, you don't remember because you think that you live forever. Or you live maybe 45 years or maybe 80 years. If you can maintain good health, people live as long as 90 years, 80 years. But most of us, we are careless and we may not live. The difference will be, see, when you're young, if you fail 1 year, you are not able to be with your friend. And you are so worried, I lost 1 year. But you are not worried about how many years you will be losing if you don't live long. Okay? Your friends would be living 80 years and you might die at 40 years or 35 for that matter, if you are not careful of your health. Okay? One is smoking. Now we have a lot of problem with people getting hypertension, diabetic. Just recently, just a few years ago, one of our students, a very young boy died because of pressure. He had pressure, and when do you get pressure? You eat so much of junk, you eat whatever comes on your plate, but you never exercise. Or you have a lot of anxiety. See, this boy didn't know that he had a pressure, that he was not doing much of exercise. He watched tennis for 2 hours. And when you're watching football match or tennis or any games, what happened to your emotion? It goes up, no? Because if your team that you are supporting is losing, then you have that anxiety. Am I right? So he must have got that anxiety, and then when you have anxiety, the pressure goes up there. And then after the game, maybe 2 hours, he stood up, he went to the washroom, never came back. When he came back, he was in the hospital. So this is just one example that happened right in front of our eyes, and just imagine how many people are dying because they didn't have good exercise. Okay? And the worst thing about, not just about exercise, young people nowadays, every time you want to eat, okay, it's always junk. For you, there's a rice and then one Maggi soup, I think suffice. And you don't know what is there in Maggi soup. And you don't know about preservatives, all those food that comes in package are scanned, radiation, all these chemicals. That is why amongst us, you will not believe, We have cancer patient. It's so sad. At a very young age like yours, you get cancer. We still have few students who have cancer. And then one reason could be because of type of food, then lack of exercise, lack of water. People don't drink water. Okay? So on this very important day, I'll not tell you so much, okay? Because so much has been said in the speech. I only want to advise you that always remember that I can become the richest person on this earth, but if I don't live long, what's the use? So give utmost care to your health. There will be also people who will be checking pressure. Okay, when you have time, substitution class, interval, lunch break na, and the pressure check. So, actually, I was this year in the beginning, ever since that boy passed away, I thought every year we will do pressure check for all our students. With energy. Oui, oui. Step, step. Knee up. Give me